If I opened your supplement cabinet right now, I could probably find three things I'd throw straight in the trash. Not because supplements don't work, because most people over 50 are buying the wrong form of the right nutrient. And the label is designed so you won't notice. I'm Nurse J. I'm a registered nurse, and I've spent years watching patients spend real money on bottles that were never going to help them. The promise. In the next 10 minutes, I'm going to walk you through the 5 supplements that actually matter after 50. The right form of each, the dose range, and what to ask your doctor. And at the end, I'll give you the 5 red flags I look for on a label. Number 4 is the one almost everybody gets wrong, and it's probably in your cabinet right now. Quick note before we start. I'm a nurse sharing health education, not your nurse. Nothing here replaces your own doctor, especially if you take prescription medication. Deal? Good. Why your body changes. So why does this even become a problem at 50? 4 things shift, and they all work against you at once. Your stomach acid drops. You need that acid to pull nutrients out of food, so you can eat well and still run low. Your skin stops making vitamin D as efficiently. Same amount of sun, less vitamin D. Every year. Your gut bacteria change, and B12 absorption falls with them. And your natural CoQ10 production declines right when your heart could use it most. Here's what that means. This isn't about eating better. You can have a perfect diet and still be low. That's the part patients find hardest to believe. Vitamin D3. Number 1, and the one I see low most often on lab work. Vitamin D3. 2 rules. First, D3, not D2. D2 is the cheaper synthetic form, and your body doesn't use it as well. If your bottle says D2, that's a problem. Second, and this is the one almost nobody's been told, pair it with K2. Vitamin D helps you absorb calcium. K2 helps direct that calcium into your bones instead of letting it settle in your arteries. Taking high-dose D without K2 for years isn't what I'd choose for myself. Typical range is 2,000 to 5,000 IU daily, but that number should come from a blood test, not from me. I'll tell you exactly which test to ask for later. Coming up next, the one that fixes the 2 a.m. wake-up. Magnesium. Number 2. Magnesium. If you're over 50 and you wake up at 2 a.m. and can't get back down, this is where I'd start. Magnesium calms the nervous system, relaxes muscle, and quiets the signals that keep your brain switched on. It's also why it helps with those nighttime leg cramps and with mood. But the form is everything, and here's where the shelf will cheat you. Magnesium oxide is the cheapest form. It's in most bargain bottles, and your body barely absorbs it. What it will reliably do is send you to the bathroom. You want magnesium glycinate. Gentler, far better absorbed. Generally 200 to 400 milligrams at night. One caution, if you have any kidney problems, magnesium is a conversation with your doctor before it's a purchase. Vitamin B12. Number 3, B12. And I want to be careful here because this one gets dismissed. Patients tell me they're foggy, they're tired, they can't find words the way they used to. And they've decided that's just what being 60 feels like. Sometimes it is. Sometimes it's B12. After 50, absorption drops. And some very common medications, including some for reflux and some for diabetes, lower it further. If you take those, this matters more for you, not less. The form to look for is methylcobalamin, the active form, not cyanocobalamin, which is synthetic and poorly used, usually 500 to 1,000 micrograms, and a sublingual, one that dissolves under your tongue, sidesteps the absorption problem entirely. Brain fog is not a personality trait. Get it checked before you accept it. Omega-3. Number 4, omega-3. And I want you to actually do something. Go get your fish oil. Open it and smell it. If it smells strongly of fish, that oil has likely oxidized. It's gone off, and it isn't doing much for your heart, your brain, or your joints. Then look at the label and ignore the big number on the front. Fish oil, 1,000 milligrams, tells you nothing. Turn it around and find EPA and DHA. Those are the parts that work. You're looking for 1,000 to 2,000 milligrams of EPA and DHA combined. Choose the triglyceride form if it says so, and buy brands that pay for third-party testing. Cheap fish oil is an expensive way to make expensive urine. CoQ10 and statins. Number 5. And this one is specifically for a group of you. If you take a statin for cholesterol, listen closely. Statins can lower your body's CoQ10, a compound your cells use to make energy. And your heart is the hungriest muscle you own. Some people on statins get fatigue or muscle aches, and low CoQ10 may be part of that picture. Typical supplemental range is 100 to 200 milligrams daily, taken with a meal, because it absorbs with fat. Now, I need to be extremely clear. Do not stop your statin. I have seen what stopping cardiac medication does, and it is not worth it. This is a question you bring to your next appointment, not a decision you make from a video. The 5 red flags. All right. I promised you the red flags. Here they are. This is what I look for on a label, and this is the list to screenshot. 1. Magnesium oxide, cheap, poorly absorbed. 2. Cyanocobalamin B12, synthetic, poorly used. 3. Vitamin D2 instead of D3. 4. The one I said almost everybody gets wrong. Proprietary blends. When a label says proprietary blend, it means they will not tell you how much of anything is actually in there. It could be a rounding error of the ingredient you bought it for. If they won't show you the amounts, that's your answer. 5. Cheap fish oil with no EPA and DHA listed. Pause it. Screenshot that. Then go check your cabinet. I mean it. Test, don't guess. One more thing, and it's the most nurse thing I'll say all day. Test, don't guess. Before you spend another $1, ask your doctor for these 5. 25 hydroxy vitamin D. B12 with methylmalonic acid. That second one catches deficiency earlier. RBC magnesium, which is more accurate than the standard serum test. An omega-3 index. And a CoQ10 level if you're on a statin. These numbers tell you what you actually need, what dose makes sense, and, just as usefully, what you can stop buying. Recap and call to action. If you remember nothing else, D3 with K2, magnesium glycinate at night, B12 as methylcobalamin. Those 3 are the foundation. I've linked options in the description from brands that pay for third-party testing. I only point to what I'd take myself. Compare them, and check them against your own doctor's advice. If this saved you from one bad bottle, hit like. It genuinely helps this channel reach other people over 50. And tell me in the comments, what's in your cabinet right now that you're not sure about? I read everyone, and I'll answer as many as I can. I'm Nurse J. New videos every week. Take care of yourself.